Another policy area to look out for, of course, in the pandemic period is health spending. The Consumers Health Forum has released the findings of the latest Consumer Sentiment Survey, which is the largest health study in the country based on the general population. Let's get some thoughts now from the Consumers Health Forum CEO, Leanne Wells, who joins me in the studios. Leanne, 5,000 Australians have participated in your research. So let's start from the basics. Why is it important in your mind to hear from consumers, not just the medical fraternity?
It's important to hear from consumers, or patients as you might otherwise hear them described, because they are the users of services, and their experiences, good and bad, can help us determine whether services are meeting the mark and where they need to be improved.
So it seems that some things are working quite well, despite the intensity of the pressure upon the health system.
Well, health is always under scrutiny, isn't it? But, you know, some of the pleasing things, the highlights from our survey tell us that, you know, 85%, almost 85% of people are really satisfied with the healthcare they get in Australia. They're really quite confident, 30% really confident about how our health system performed during COVID. And we saw the burgeoning of telehealth. So, you know, another highlight was that we saw the community really embrace digital healthcare.
We've adapted, haven't we, in a lot of different ways, in health as well. But some areas still missing out. What did you find there? Yeah,
look, there are. I mean, I think the real lowlights, I think rural and remote Australia, we've got two Australias. You often hear people say, respondents to the survey said that there's just no services in some areas of rural Australia because the doctors and the nurses are not there. We've got young people experiencing very high levels of mental health distress. And we've got, I suppose more concerningly, people with chronic conditions saying they can't afford healthcare, they can't afford to fill a script, they can't afford to, you know, pay for really vital medications, and that speaks, I think, to the general cost of living broader issue that we're faced with at the moment.
People finding it tough to get by at the moment. But what would you want to see on your main priorities? What would you like to see the government do in this budget to ease some of those pressures?
To ease some of those pressures? Well, I think we need to look at better access to general practice and what we call team-based care. GPs working with nurses, working with pharmacists, working with physios, with a changed funding model for that to happen. Because at the moment, one of the breaks in our system is 6-minute medicine. You know, GPs are only paid on a sessional basis, whereas if there was a different way of funding that, it would be better for the doctors and the people they work with, but so much better for patients, so much more comprehensive care.
And I guess even more so for people with chronic conditions who have to have care a lot.
That's right, over a long period of time. That's right. I think the other thing we need is a much greater investment in preventative health. You know, keeping people well in the first place. We need at least 5% of our health budget spent on that. And the other big issue, I think, for the community that we hear time and time again is access to affordable dental care. People are just going without dental care because it is just cost prohibitive for them.
So are they the key themes you think consumers want to hear your responses on?
Yeah, primary care or general practice reform, better public subsidisation of dental care, and far more investment in preventative health and wellness services.
Okay, Leanne,
so we're keeping people well and out of hospital.
Leanne Wells, CEO of the Health Forum of Australia, the Consumer Health Forum. Thank you. Appreciate your time.